Good morning, good afternoon, and good evening, everyone, wherever in the world you may be joining us from today. My name is Francesco Del Carpio, and I am the CIFAL York Operations Coordinator. I would like to officially open the third session of the Climate Change and Global Occupational Health and Safety Speaker Series in partnership with the Restore Lab at the University of Toronto, the Dahdaleh Institute for Global Health Research, and the Global Labor Research Center with a land acknowledgement. We acknowledge and recognize that many Indigenous nations have longstanding relationships with the territory upon which our campuses are located that precede the establishment of York University. The area is known as Takaranto and has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. The territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. As this is an online event, our participants may be joining from various locations, so I strongly encourage you to learn about the traditional land upon which you are located. With this, I welcome our moderator, our speaker, and our participants from around the world. Welcome to our webinar. Without further ado, it is my great pleasure to introduce our moderator, Dr. Godfred Boateng. Dr. Godfred Boateng is an assistant professor at the School of Global Health, director of the Global and Environmental Health Lab, and a faculty fellow at the Dahdaleh Institute for Global Health Research at York University. Dr. Boateng is an expert in the design and application of culturally relevant scalable methodologies to study the multidimensional factors and processes that shape health and health equity across spatial scales, household, community, institutional, and national, and how they can be promoted and sustained. His research program is transdisciplinary and focuses on resource insecurity, health, and sustainable livelihoods, the socio-ecological determinants of cardiometabolic conditions in aging adults, social inequity in health systems, quantitative data analysis methods and survey scale development, and COVID-19 related health effects. Dr. Boateng's research in these areas has been critical in transforming the understanding of the key social and structural determinants of health among vulnerable populations, including women, infants, children, and older adults. Dr. Boateng, thank you very much for moderating our session today. The floor is now yours.
Sure. Thank you so much, Francesco, for that kind introduction. Indeed, the impact of climate change on health takes multiple pathways, and today we'll be looking at one of those pathways, to which we have our speaker for today in the person of Dr. Behdin, Nowrouzi-Kia, who is an assistant professor in the Department of Occupational Science and Occupational Therapy at the University of Toronto, where he also holds the inaugural Emily Gilsala Grant Early Career Professorship in Workplace Mental Health. Through an occupational lens, his research program is a systematic study of occupations in the areas of work disability prevention, return to work, and disability management. This approach is designed to produce results directly applicable to identify and assess risk and to develop interventions for preventing or improving high-risk behaviors in the workplace. Dr. Nowrouzi-Kia's work is motivated by efforts in the field of work disability prevention that extends beyond the efforts to prevent or cure diseases from a purely physical perspective towards more holistic approaches. The major tenets of his work use a biopsychosocial perspective to understand work disability and extend towards incorporating personal characteristics and environmental factors in improving health outcomes. Dr. Nowrouzi-Kia is also the founder of Infinity Health Consulting Group and OT Services North. This afternoon, he will be speaking on the topic, climate change and impacts on mental health in occupational settings. This session will run for the next 40 minutes, after which we would have about 5 to 10 minutes for a question and answer time. Please type in your question in the chat box or raise your hand using the raise hand symbol at the bottom of the Zoom frame, and you'll be called upon. I will now hand over to Dr. Nowrouzi-Kia for his presentation. Over to you.
Thank you very much, Dr. Boateng, for that kind introduction and warm welcome. Delighted to be back with you again for my second session. And hopefully this will provide some continuity to my first session, where I spoke a little bit more about the relationship between climate change and health and well-being, with an emphasis on occupational settings. Today, I invite you to, as Dr. Boateng so eloquently put it, to come down one of those pathways. And one of those pathways is to look at the relationship between climate change and mental health. It's quite a large topic, and I have the, I suppose, the privilege and also the challenge of doing it in a very short amount of time. So I will do my very best. And now I have a slide deck, so I will share my slides with you, and we'll proceed with it as well. Okay, so do you see my slides? It should be the full presenter mode. Is that right? Okay, thanks, Francesco. A little bit about me for those of you that are first joining. And I think this will inform how I look at the topic and the relationship between climate change and mental health in occupational setting. So I have a clinical background as an occupational therapist. I've worked for the past 17 years. And what an occupational therapist is a regulated health provider that oftentimes works with individuals in a variety of different settings to support their functional ability to do the activities or the things that people need to do, and want to do and love to do. So some classic examples that you may hear about is someone may have a stroke and they want to go back into the home, and they want to be able to do their activities of daily living related to self-care, like put on their clothes, go to the washroom, brush their teeth. That's something that an occupational therapist will work with those types of individuals or patients, if you want to use medical term. Oftentimes, but it's a very broad discipline and field. I work in the area of occupational health. So oftentimes I'm involved in occupational health and safety issues and settings, aspects around assessment, treatment, identifying what somebody's capable of doing, and then finding an alignment between their abilities and what the actual job is all about. So to me, this is a significant issue, because oftentimes what I present to you today will always be influenced by that health background that I bring into the conversation, and the particular emphasis on looking at the complexities of mental health. So having said that, now I will go to my second slide. I have some disclosures. So I do hold some funding. I do get some consulting fees as well. They're listed on the screen for you to take a look at. And I also have an affiliate scientist position at a teaching hospital that's affiliated with the University of Toronto. I don't have any conflicts of interest to declare. And what I will be presenting to you today will be based on evidence that is peer-reviewed and substantiated in the scientific literature. So what I will be presenting will be evidence-based. I won't be taking anything that isn't supported by the scientific literature. And I'm pretty confident that we'll have a robust discussion talking about some of the topics that I'll talk about, and also how they're related to occupational and occupational health, and particularly mental health, and the impacts as a result of climate change. For those of us that are in this space of occupational health and safety research, the idea of climate change may be relatively new, although there are papers from colleagues of ours, particularly in the occupational medicine, that have talked about these issues for at least a decade. But for many of us from the health side, this is something new. We're starting to understand that our health is going to be intimately tied to what's going on in as a result of climate change. So today, hopefully what I will do is unpack that a little bit. I'm an academic at the end of the day, so I'll be talking a little bit about some of the theoretical underpinnings around these issues. Where do I situate myself as a result of the theoretical aspects? How does that drive and influence the work that I do? And more important than that, I'll present some models, some frameworks that influence some of the solutions and strategies when we actually do research in this area. And then finally, give you some examples of how it relates that to mental health. So I'll start off by kind of going back to what was said about me by Dr. Boateng in my introduction, which is that I use a biopsychosocial approach. And you might wonder, what is that? I've heard the term, but I'm not entirely sure, or I've never heard this term before. And I come from a biomedical perspective. And it goes something like this. Traditionally, and this is an idea that is widely accepted and widely understood by the general public as well. If you have, for example, an ailment or a disease, you go to your primary care provider, let's say your family doctor, your general practitioner, your nurse practitioner, etc., and you see them, and then you say, my leg hurts, fix it, treat it. And that's the traditional biomedical approach. That is that there is a deficit or a disease or illness, and if you take away that deficit or you treat that disease or illness, that will rectify or resolve the issue, and then there'll be everything will be great and you'll be back to normal. However, what the literature has consistently demonstrated in the occupational health and safety sphere now for many decades and beyond that, but I'll focus on occupational health and safety, is that that model does not work, unfortunately. I will present to you some theoretical frameworks that have been established for the past 30 years that demonstrates that we have to look at it through a biopsychosocial lens. So what do I mean by the biopsychosocial lens? So the World Health Organization in 2001 introduced this idea of the International Classification for Functioning, Disability, and Health, which is a very well-known framework in the health space, which really argues that we have to be looking at the individual in relation to their functioning and their ability to engage in the things that they want to, need to, and love to do. So if you notice that in this figure that's from the World Health Organization, activities has quite a prominent role as central to the individual. In addition to that, it does recognize that there's a biological piece, so the bio piece of the biopsychosocial model, but it also challenges us to look at things through an environmental lens, a personal lens. So what are the person's coping strategies? What's their resilience like? So from a psychological perspective, perhaps from an environmental piece, what's their built environment like? What's their social environment like? And what about their functioning? It emphasizes the importance of functioning, and that it is, what is it that the person's trying to do? And you will see this clinically that often with patients and individuals that will come to you and present and say that they have extremely terrible symptoms, but it doesn't impact, or it minimally impacts, their activities of daily living or their instrumental activities of daily living. And then you will have patients that present and have very few symptoms, but it's debilitating to them and they're not able to do anything. For example, when it comes to their paid occupations or their occupations at work. I use the term occupation from occupational therapy, which means activities. So that's what I mean. I don't just mean paid work. All this to say is that we want to use a very holistic perspective that recognizes the biological considerations, but understands that there's far more for us to understand in terms of supporting people's health and well-being through the environment, personal factors, their functioning, and also the actual condition itself. So here's a couple of examples. I've deliberately picked a physical and mental health example to provide you with some context of how the ICF can be used in an occupational setting. And you will notice that, if there's somebody that has a spinal cord injury from the medical perspective or the biomedical perspective, you would only focus on the spinal cord injury and say that if you can resolve that issue, then the person will be completely fine. There'll be nothing else to worry about. We know that that's not the case. People that have incomplete or complete spinal spinal cord injuries, that are tetraplegic or paraplegic, have lots of issues that are far beyond just the presentation medically that they look at. We've written about this in the return to work context, for example, that people may experience debilitating levels of depression, anxiety, not want to engage in functional aspects of work, of self-care activity, of leisure or play activity, and how that is extremely difficult. The ICF provides you with a model to look at the different considerations that person could have. So you look at their functioning aspects, you look at their gait or their locomotion or walking rather. You also look at what it is that they're trying to do. Maybe they're trying to go up and down the stairs, and how do you resolve that? Maybe there's assistive equipment that they could use. Maybe there's accommodations to the environment that can be built. For example, maybe there could be a chairlift that puts up so that they don't have to go up the stairs if they can't. You also look at technology, assistive technology. You look at the individual and look at their strengths. So what is it that they have going for them that you could use to leverage? Maybe they have strong social supports. Maybe they have a very supportive family. Maybe they have adult children or others that can support them in that capacity. So you kind of take all of this into the picture. And I'm deliberately spending some time here to kind of orient you and prime you to start thinking about this through a biopsychosocial lens, because when I provide the examples of the climate change and mental health relationship, this is exactly what I will be doing, is that I'm going to be going looking at it through a biopsychosocial lens. So I'll challenge you that if you are much more comfortable with the biomedical lens, to step back, reflect on using these types of models in a biopsychosocial way. Similarly, you could apply this through a mental health perspective. I won't spend too much time on it, but similar kinds of analogies around identifying the biological considerations, identifying the disorder, looking at what it is that they're trying to do, look at the functional aspects of it, and then the other attributes that are aligned to it. So the ICF will work quite well for any type of presentation, whether it's mental health or physical health. Similarly, in the return to work and the occupational health and safety context, we also have to recognize that prevention is key. So Patrick Loisel, who unfortunately recently passed away less than a year ago, was I would say, the father of work disability prevention work. And he introduced this model called the WDP. Sometimes it's called the arena model because it looks like an arena in a stadium setting, or the Sherbrooke model, where he developed this in Sherbrooke, Quebec, Canada. And as an orthopedic surgeon, he oftentimes saw that his patients would come to him and say they have low back pain. And when somebody has low back pain as an orthopedic surgeon, you're trained to do surgery, so you perform surgery. But what he was continuously seeing in the late 80s and into the 90s was that these patients would come back into his patient roster and tell him that the back pain wasn't going away, and he was perplexed as to why, if he was providing a very precise surgical intervention using the biomedical model, that these individuals were continuously going back and taking time off work and all of the other aspects that come to it. And he came to the realization, after doing some additional studies and research, that you really have to consider the different manifestations and the different considerations that come into the occupational health and safety sphere. And that is that there are different systems at play. Those systems include the personal system, where just like the ICF, you're looking at the personal considerations, the individual's relationships, and so forth. You look at the healthcare system, and oftentimes the biomedical lens will focus almost exclusively on this part of the model, which is that if the person can get treatment, everything's going to be all right. And we know, and I know this, and anybody who is worth their salt, both clinically or research or both, knows that this is no longer good enough to just look at it through a health perspective. We also have to recognize that there's the organizational culture. The workplace setting itself plays a significant role. And in fact, the Surgeon General in the US came out in late October, early November of 2022, and he made a bold statement saying that the workplace has a significant role in supporting individuals' health and well-being. And that goes a lot when it comes from the US Surgeon General and the Department of Health and Human Services. Similarly, we also have to recognize that because you're dealing with work, wherever your jurisdiction is, that you're also going to be dealing with the legal system. You're going to be dealing with insurance. And these types of considerations have to be brought into this. And what I really like about this framework, and I'll invite you that when I provide these examples through climate change and mental health, is that it situates the individual at the middle. And I think that's such a wonderful thing that it does that, because it allows and recognizes that the individual that's most central and most important is the person who has experienced that illness or the disability, and that as a result their needs have to come first and foremost ahead of anybody else, and they will interact with the system in a variety of different ways. Similarly, from my clinical background, we have a model that I oftentimes use called the person, environment, occupation. And succinctly, when you have these three spheres meet in the middle here, kind of like a Venn diagram, you have maximum functioning and occupational performance. So if you optimize this confluence of these three spheres between the person, the activity that they're doing, and the environment that they're in, you're going to maximize functioning. And recall again, just like the ICF and the WDP framework, all of these frameworks really look at it through a much more holistic and comprehensive way, recognizing the complexities of occupational health and safety. Similarly, out of the Finnish Occupational Health Institute, the workability framework looks at it also through a very positive and cup half full kind of approach. So rather than looking at it just through a deficit-based approach, they're looking at it through an abilities-based approach. So if you went to see your healthcare provider, wouldn't you like it if they said to you, let's not focus on what you can't do because of what's going on. Let's focus on what you can do. And exactly what the work ability framework does that. It actually uses language around workability rather than work disability. And some of my colleagues around the world don't even like that in North America we always focus on the disability rather than the ability. And I agree with them. I think there's a lot of worth in looking at what people can do. If you look at this house diagram, it has different floors, and each floor considers the different aspects that are important to the individual in their recovery and their ability to work. So you'll notice that all the things that we've talked about in the other frameworks are there, but what it emphasizes is the importance of what the work environment is like. It's got a larger stage. It has 2 panels as opposed to 1, 2 windows, if I can use the house analogy. And if you go up these stairs and you get to the top, you kind of get to the confluence where it's the workability or that individual's self-belief perception of doing their job. Now, there's a lot more to the workability framework that I don't have time to talk about, but I wanted to kind of present this to show you that it focuses on the highlights and the strengths. So it looks at it from a very strength-based approach that will be very helpful to us as we go through our examples. Similarly, one of my previous clinical students and I kind of looked at this idea of emphasizing not only the strength-based approach, but also through a prevention lens. So traditionally, lots of interventions in healthcare in the occupational health and safety sphere have focused on a reactionary approach. So after an injury or an illness, once somebody is already hurt or not feeling well or off work, that's where all the interventions start. What we challenged our colleagues to consider is that we also have to look far more upstream before the issues are causing significant issues. Not only are they more cost effective, but it avoids people going down the path of disability, of illness, of injury, and all those deleterious outcomes that we don't want to for them to experience. So this was something that we wrote in the American Journal of Occupational Therapy in 2017, and we continue to practice what we preach. So a lot of the work that I do related to prevention focuses exactly on this type of model. Now, I just want to give you some context from the occupational health and safety side as to, what it is that you would see. So if you're looking at somebody who's been impacted by illness or injury, there traditionally are different stages and different approaches. And I would say that for the majority of people that come or experience an illness or injury, they won't have a problem with going through the insurance system, the compensation claim, and they're fairly straightforward issues. But for about 20 20%, they get into the red side of this diagram, which is the short-term and long-term disability. And that's where a lot of my efforts as an occupational therapist and that of other health providers and other stakeholders involved in their care is emphasized. And that's where we put a lot of our efforts. Obviously, it's far more reactionary. It's after the fact. We're dealing with increased complexity in terms of the individual, their job, the relationships that they have. Sometimes they're off work for years and years. And the literature has consistently demonstrated to us that we need early intervention, because the longer you wait, the less likely it is for someone to go back to work. That's something that's been established for many, many years, but it's beyond the scope of my talk today. But you'll just have to take my word for it. But that's really where the emphasis is. And that's why, again, to kind of bring together that thread that ties all of my examples, is that we and the models and frameworks that I presented, is that the focus should be on a biopsychosocial approach. So meaning that we look at it through a holistic, complex worldview, and two, that we recognize the importance of prevention to avoid getting our patients or our clients into this right box, because this is not where anybody should be going. So having said all that, I also want to talk about this idea that's well entrenched in my world of occupational health and safety, but maybe you come into this from a disaster management perspective, from others where these might not be as explicit. Maybe they are, and apologies if they are, but I think it's worthwhile repeating it for all of our benefit, in that there is a relationship between work and health, and that generally working is good for your health. Is identified as a social determinant of health, meaning that working will provide you with positive aspects. In fact, my entire clinical background is based on the tenets of engaging in meaningful activities, and those meaningful activities can provide you with positive results in life. Of course, like anything else, work can be deleterious as well. Too much work leads to poor health, whether it's physical health or mental health. For example, if you have a registered nurse here in Ontario, Canada, who's working at a hospital and they're lifting patients with elevated body mass index, naturally they're going to be more prone to experiencing acute low back pain, particularly if they're using poor body mechanic techniques. Similarly, if someone is working too much as a result of the COVID-19 pandemic, increased rates of burnout, job stress in our healthcare workforce here in Ontario has led to a mass exodus of very qualified healthcare providers that we desperately need now, and we're experiencing with a severe shortage. I know this is nothing new to many other jurisdictions, but it's worthwhile demonstrating that this relationship between work and health, when it's rightly balanced, can be quite beneficial, but that too much or too little of it can also be challenging. This is just another way of demonstrating that relationship, and that it goes onto a continuum. Too little work can also be impactful, particularly if you're looking at individuals that are underemployed or not employed at all, or outside of the health sphere and beyond what we're talking about, or in the incarcerated populations. Those are other aspects that would look at more of the underemployment side. Finally, I wanted to kind of just further emphasize that work and health are intimately tied. It's one of the most common questions we get asked after, "Hi, what's your name?" is, "What do you do?" So for us as individuals, as human beings, our work is a very close part of our identity for many of us. Even when we're retired, it's something that we take pride in for a variety of reasons, whether it's employment, whether it's financial, whether it's personal pride, whether it's showing off our accomplishments, and so forth. So now that I've kind of hopefully primed you on the idea of what may be appropriate frameworks and lenses to look at occupational health and safety, let's look a little bit more about climate change and health. So hopefully you can see this. If you can't see this, I'll summarize this to you in quite a short. This is from the WHO World Policy Brief on the impacts of climate change on mental health in particular. And you can consider that there are different spheres, or there are different shaped boxes, and each of them are related to the impacts of climate change. For those of us on the occupational health and safety setting, we recognize that climate change, for a variety of reasons, are influencing how people are working, and in particular, it's impacting their mental health. I mean, you could argue that pandemics and situations like those are in part as a result of climate change. You could certainly also argue that natural disasters are increasing individuals' propensity for experiencing mental health outcomes. And on top of all of that, as you look at this diagram, you should be recognizing that it's going to impact different parts of the world in different ways, naturally, particularly where resources are less available and access to services are less available. Now, that is quite significant, and I'll talk a little bit more about that in a moment, but that access to care is a significant challenge, let alone if you remove it outside of climate change induced changes and the impact that it has for the majority of individuals. Access to health services, including primary care, rehabilitation, is a significant unmet need. So there's a lot more demand than there is the need to meet that demand. This becomes challenging for a lot of individuals. And if you look at the figure that I have, you look at climate change related hazards, for example, floods, storms, and so forth, as being some of the considerations, deluges, drought, etc. You also look at it as it relates to threats to the environment. You look at it in terms of how these threats are experienced by individuals, and we'll talk about some examples to that. We'll also talk a little bit about the possible mental health implications of it, and some of the ones that are particularly pronounced in workplaces, and you may have heard about it on in the popular press, or maybe on social media, or with your conversations with colleagues in your different work settings, as the idea of burnout and job stress. So these are becoming really, really important issues that have to be further investigated. And now, for those of us that are in this space, we have the added dimensions of climate change to add on to the work that we're doing. So here's some examples that may be relevant to consider when it comes to hazards. Those hazards, for example, if it's a flood or a drought, may cause intense distress. And if you think about that distress, with a lot of mental health conditions, or many of them rather, they're episodic in their nature, meaning that, there's ebbs and flows, highs and lows, and people may feel better at certain periods of time, and then they go into a downturn and things get worse. And that becomes particularly challenging as opposed to physical health manifestations, because you're looking at providing services and care over a longer period of time, being responsive to individuals after, for example, a climate related hazard such as a drought or flood, and that it takes a long time for people to recover. If we think about the COVID-19 pandemic as being an example, you could argue that, since it started in late 2019, early 2020, we've gone through an acute phase period where there was a high increased rates of infection. Many of us got infected. Now, as we transition to the next or transition out of the acute phase, we go into kind of the next stage of it, and that's sometimes referred to as like the fourth wave. That fourth wave being the mental health considerations, or the impact of it from a mental health side. And you understand that people experience high levels of isolation, depression, distress, and now we're only starting to see those types of presentations manifest itself in society. So I can give you some examples of that. Older adults here in Canada and in Ontario, as a result of the early days of the pandemic, were locked down in residential retirement homes, nursing homes, and many of them that had maybe cognitive issues would oftentimes be isolated. And if you know a little bit something about neurodegenerative diseases like Alzheimer's, dementia, etc., you'll know that isolation further amplifies the devastations of these diseases. So if you think about how climate change can relate to distress, it can further exacerbate things. And this is in a resource-rich country like Canada, where we have access to care and so forth, and we're seeing devastating impacts. If you extend this to a climate change hazards that are presenting, for example, as a result of natural disasters, hurricanes, cyclones, etc., these impacts are further amplified. And then this leads to the complexities of the mental health conditions such as depression, anxiety, post-traumatic stress disorder, isolation, suicidality becomes significant issues. I've also considered, from a biopsychosocial perspective, that we do have physical considerations to look at as well, and those are tied to your mental health as well. It's very difficult to talk about mental health in its isolation without also considering that our physical aspects are tied to our mental health and vice versa. So some other examples globally where this may be the case was in 2019, where Cyclone Ida hit Zimbabwe and other parts of the world, and how debilitating the impacts were. The climate change impacts were longer, they're stronger, and in general, they impacted people's mental health being for long periods of time, continuing to do that today. Destructions of homes, the lack of access to potable water, food, their means of livelihood and employment being cut off. All of these are impacts that are very long lasting. And I can tell you that as a clinician, it's far more straightforward to deal with the physical aspects, where you have somebody that may present to me with mechanical crush injury as a result of working in a factory, and they need rehabilitation or they need specific type of care, than as opposed to someone who comes in and says, I've experienced a natural disaster as a result of a cyclone or a flood, and now I'm completely devastated. I've lost 3 of my family members. I've lost my livelihood, which was my farm and growing my crops, and I don't know what to do with myself. These are issues that are not going to be able to be resolved in a linear fashion, but rather will take a lot of time. It will take gradual, incremental resource supports, and that at times there will be setbacks, and there will be more of that ebb and flow that comes mostly with a lot of mental health conditions. So all of that to say that we have to consider that from the aspect of mental health considerations, but also, if you want, I'll consider that when you're looking at it through a biopsychosocial lens, to look at it also through the intersectionality. So the different aspects that people experience mental health crises. And that is, for example, that you're going to be looking at globally in the global south to be a disproportionate increase for vulnerable people that don't have, for example, homes that are in secure areas. The infrastructure is not appropriate. They don't have access. And that adds to their intersectional considerations. So, for example, if you have people in the global south that are of certain ethnicities, of certain classes, of certain genders, all of this has to be considered into our considerations as occupational health and safety practitioners, and others that are in the emergency response and the world as well, because we have to recognize that certain groups are going to disproportionately experience these for better, for unfortunately, because of climate change and the impacts that it has on their mental health. But it's not just a clear cut of just mental health and the linear relationship to climate change, but rather that certain groups will experience this and continue to experience this as a result of just their positionality in the world. I wanted to kind of talk a little bit more about the fact that if we look at this from a very broad level, macro perspective, we really have to do a couple of things to alleviate the situation when we're looking at climate change and mental health. One is that we don't have enough access to practitioners and the specialized skill sets that we need. So when people are in distress, when people need these services, that they're available to them globally. Even in resource-rich places like Canada, we have a shortage of them. But in parts of the global south, there's almost virtually no access to these types of services. And I can tell you that from a rehabilitation perspective, the unmet needs are significant. Over 1 billion people don't have access to rehabilitation care services. And just imagine the complexity of the climate change and the aspects that it has on their health and mental health in particular. So one is to increase access to care through augmenting health human resources strategies. So we need increased training. We need increased emphasis on building more capacity, not only just in urban areas, but also in rural and remote regions where some populations will be residing, and reflecting that what care is provided is culturally appropriate and relevant to them. So it should be complementing their lived experience, their positionality, their health and well-being. Similarly, from the policy perspective and from the research side, this is a drop in the bucket. We've started looking at these types of considerations in work settings in Canada, and there is very little written around these types of topics. So there is a significant need to understand the complexities of health and well-being in occupational settings by increasing research. We also have to do research that is mindful and ethical of the different considerations that different populations have. So for example, here in Canada, if you're going to be doing research in occupational settings, know the groups that you're working with. We have a historical, we have a history here of Euro Canadian colonialism against the indigenous populations. So if you're going to be working with indigenous populations, looking at climate change and mental health, those have to be done in a culturally appropriate way. Similarly, with other populations that we deal with, maybe new arrivals to Canada, or different groups such as Franco-Ontarians or Canadians and so forth, children, older workers, all of these require us to understand and provide more research capacity from that perspective. And then finally, we want to ensure that we can work together through a cohesive nature that can brings us together through strategies that are mindful of the impacts of climate change on mental health in particular. Oftentimes, mental health doesn't get the same attention as physical health or the considerations that come with that. So we want to be open to those types of discussions, destigmatize and take away the stigma that comes with mental health in many different parts of the world, where people may have a mental health condition, but they're put away, they're shut out from getting access to care. It's something that is not talked about. And to us, maybe in certain jurisdictions, you might wonder, well, that's not the case anymore, but there still is a significant amount of those types of conversations that have to be had, and ensuring that we do so in a respectful way, in an appropriate way. Yeah. I think I've talked a lot about these, the fact that it's interconnected to our health and well-being. And that we have to be working together as a collective on many different fronts: the research front, the access front, and so forth. So I think I'll stop right there. Actually, before I stop, I also just again wanted to recognize and highlight my lab, the Rehabilitation Sciences through Occupational Research and Engagement Lab. I have the privilege of being here and presenting this work to you, but certainly it is not all my contribution. There's a lot of people that stand behind me and support the work that I do. Our diversity and our different positionalities is a source of our strength. So some of our team members will have experiences and expertise in certain areas, and they will step forward and provide their expertise. At other times, I will, and so forth. So we have a large group of very talented individuals that I invite you to read more about. If you're interested in collaborating with us, learning more about the work that we do, I'd be delighted to have that conversation with you. So yes, I will stop right there.
Thank you so much, Dr. Nowrouzi-Kia, for that insightful presentation. I believe we've learned quite a bit from the presentation. He excellently explained the concept of biopsychosocial health, how it relates to occupational science, He went on to describe the workability framework, stages of disability management, the relationship between climate change and health, showing the multiple pathways. And then he narrowed down to focus on mental health conditions, isolation from social support, suicidality, and fiscal conditions. Finally, he outlined steps to protecting workers' mental health against climate change. This is such an excellent presentation. And so at this point, if you have any questions, I'd like you to type them in the question and answer chat, or you can raise up your hand and you'll be called upon to ask your question.
Just to start the conversation, if I may, I have a question, please. Sorry, I cannot type in because I'm in the panel side.
No problem.
Thank you very much, Dr. Nowrouzi-Kia, for a great talk, and so important it is. You covered a lot about the impacts of climate change, especially on mental health, especially through extreme events, particularly, for example, hurricanes, etc. I was recently studying on some of these, especially from the extreme heat impacts on mental health, particularly. For example, studies trying to understand the impacts of climate change through extreme heat on violence and all kind of violence because of the, of course, biological and stress situations that extreme heat creates. I wonder if there are any studies in Canada particularly about this, considering recent increase in extreme weather events in Toronto, in Vancouver, and other parts of the country. Just curious if there are studies on that you know of. Thanks.
Yeah, thank you for the question, Dr. Asladi. No, I'm not aware of anything like this. I can tell you that honestly, this whole area of research is quite still in its infancy. I've written and read quite a bit on workplace violence, particularly in health settings, but oftentimes the considerations of climate change or those types of aspects are never even put into it. Like, for example, there are many papers and studies and frameworks of different approaches to experience how somebody experiences violence. For example, is the violence as a result of a colleague, a patient, of family, and there are frameworks around that, but there's very little, as far as I know, written on this topic, at least not in the Canadian context. I mean, I don't know the entire literature around it, but my guess is that there still is very much work to do on this, but I'm not aware of anything that's written on it.
Thank you so much.
No, thank you so much, Dr. Asghari. I think in relation to that, at least not from the Canadian perspective, but from a low and middle income country setting, that there is just a little work, and that is not even in relation to the occupational setting. My own work that looks at climate change and its impact on functional disability, right? Where functional disability is construed or characterized as deficiencies or difficulties with activities of daily living, as well as instrumental activities of daily living. So I imagine things like that could seep in, but also when I think of the workplace setting, I'm tempted to look at some particular settings where individuals are exposed to tons of poisonous gases, right? And so these poisonous gases become more intense because of extreme heat or extreme cold. But I was going to ask you the question in relation to thermal comfort at the workplace, right? Thermal comfort is sort of disturbed or destroyed in some ways because of extreme heat or extreme cold. Workers do not feel the comfort. Maybe in this part of the world we have that, but in some other parts where there's extreme heat without air condition, and even that has its own consequences, what can be done, or what can be put in place? And the second has to do with there are some workplaces where or occupations that also contribute in some ways to the carbon footprint, right? And so even though climate change has an impact on people working in those settings, I wonder what occupations could do by themselves to also reduce, the extreme temperature, the extreme heat, by reducing their carbon footprint.
Yeah, no, I wrote down both your questions so as I remember to answer them in sequence. The first part around, what strategies are in place to deal, for example, with what we call like occupational hazards such as heat or cold or temperature, pressure, etc. And this is where those frameworks that I presented could be a way from a very high level to look at it. So there's expertise that is not in my field, but like those in occupational hygiene or industrial hygienists that will go in and measure these types of hazards in the workplace and then identify potential mitigating strategies. But from my point of view, as somebody who works in these settings, oftentimes I'd like to go in there and observe the work setting, see what it is that the person does, and then find ways to either provide strategies, whether it's personal protective equipment, PPE. Everybody knows what that is now. If I would have done this talk to you in 2019, many people wouldn't even know what that is. But those types of strategies, that could also be the way that someone does the job itself, and looking at difference is in that. So those frameworks could be ways to mitigate against exposure, and also to dampen someone's risk profile so that they don't get hurt. That's on the prevention side of things. So that is quite well developed in the occupational health and safety sphere already. I think there's lots of different frameworks and approaches that you can take to that, depending on what the exposures are that you're looking at. On the physical aspects of things, yes, there are disciplines that deal with that have much better expertise than I do. On the mental health side, it becomes far more nuanced, because you're looking not only at potentially the environmental considerations from exposures to different types of hazards, but you also have this idea of individuals and that work culture that could make things a lot more complicated. And I'll just provide a couple of examples. I was working with someone who was working in a northern part of Ontario, and they worked in a small factory that was only the only source of employment in that small town, but they were having difficulties with interpersonal professional relationships that led them to go off work for depression and anxiety, and they didn't want to go back there. They never want to go back there. But that presents us with significant issues with understanding, if this person can't go back there because the environment is quote unquote toxic, what do you do with that person? So these are the significant challenges with mental health. In larger resource based and settings, we have a lot more capacity, and there's also more latitude from the employer side. So the employer has more options. But in settings where mental health is the primary issue, it becomes very, very complicated to deal with these types of considerations. In that example that I just provided in the small factory setting, that person had to go off work indefinitely, and they couldn't return. And that's unfortunate, because they still had a lot of to contribute to society through their productivity, but that couldn't happen. And that's because of the mental health complexities. They just get too involved. The second part is, what can your second part of your question was, what can workplaces do to minimize their carbon footprint? For obviously strategies that they can implement to make sure that their efficiencies in terms of they're producing something are much more carbon neutral and so forth are the way to go. It's not really something that I explore at in my research program. We're far more looking at it from the aspects of, if this event occurs, or if we can prevent this event from occurring, how does this impact somebody's health? So I can't provide a whole lot of expertise on that front, only to say that there definitely are ways that workplaces can do things more efficiently, and also do them in a way that is going to make sure that the impact on the environment is less. But I leave that to experts like yourselves to provide us with more insight. I'll stick to more of what I'm more comfortable with on the health and safety side.
Sure.
And thank you for the question.
No, thank you. Thank you for the in-depth explanation and clarification. I'm not sure if there is another question. I do not see any hands raised and none in the chat, but all too soon, we've come to sort of an end of our presentation for today, and it's been quite an excellent opportunity to learn from Dr. Nowrouzi-Kia. I hope you would have the pleasure of reviewing this session again and take on things or the ideas that you probably did not get right away during the presentation. Thank you so much. I would like to hand over to Francesco to bring us to a close.
Thank you very much. Thank you very much, Dr. Nowrouzi-Kia, for that great presentation. And thank you, Dr. Gary and Dr. Boateng, for those questions and the great discussion after the presentation. And thank you as well to everybody who joined us today, who took the time to be here to watch it live. And as Dr. Boateng mentioned, the recording will be up on the event page and on our YouTube channel, which I've shared in the chat, if anyone would like to go back and rewatch it or share it with their networks. And just quickly before we go, I'm just going to share my screen with just to showcase the next session that we have 2 weeks from now, again, Wednesday, May 24th at the same time, 12 p.m. Eastern time, Toronto time. It will be Dr. Vijay Kumar Chatu's second session of the series, focusing on climate governance through global health diplomacy and climate diplomacy. So for all of you who are interested in this topic, please mark it down in your calendars and save the date and time. And as always, you will be receiving reminders for this session as the date gets closer. So with that, I would just like to thank everybody again for being here and for the presentation. And we can conclude the session there.